Hello, I'm Dr. Sneha Tikku from Care IVF Kolkata, and I'm going to be talking to you about the various treatment modalities that are available for patients of polycystic ovarian syndrome or PCOS. PCOS is the most common hormonal disorder in women of reproductive age group. There is no single permanent cure for PCOS, unfortunately, but various treatments are available, and these treatments are based on what is the main complaint or the main problem that the patient is facing. One of the issues that a lot of patients with PCOS face is menstrual irregularities. A lot of women do not ovulate or do not have regular periods when they have PCOS. So these can usually be treated by medicines. The medicines that are commonly given for making the periods regular in patients of PCOS can be hormonal pills. These ensure that you get your periods regularly and the flow is also controlled. Another help with using contraceptive pills or hormonal pills in patients of PCOS is that it can reduce your risk of developing cancer of the lining of the uterus. Because women with PCOS don't menstruate or don't ovulate regularly, the levels of the estrogen hormone in their body can be quite high. Because of this, it puts them at an increased risk for endometrial cancer or cancer of the lining of the uterus. Getting regular periods by taking hormonal pills is helpful in reducing this risk. Then a lot of women who have PCOS can have issues with fertility. Because PCOS women might not be ovulating regularly, they don't have their periods regularly, so conceiving naturally can be an issue. However, these women respond quite well to medicines which induces ovulation. One of the most commonly used drugs for this is clomiphene, and this is usually given from the second day or the third day of the period, usually started in the first 5 days and given for about 5 days. A lot of women do ovulate with clomiphene and can conceive with it. Another drug that is popularly given to women with PCOS is called Letrozole. It is also one of the first line drugs that can be given to women who are planning to conceive and have PCOS. It is also very good at inducing ovulation and can help in women getting pregnant. Another drug that is commonly given to women with PCOS is Metformin. Now, this is a drug that is an insulin sensitizer, and it works very well in PCOS women. This is because one of the most important hormonal changes, one of the most important metabolic changes that happen in a woman with PCOS is insulin resistance. And insulin resistance has in fact been seen in both PCOS women who are obese as well as those who are not obese. Metformin is an insulin sensitizer and then helps the body in reducing the amount of insulin that is there. And this can help in women regulating or normalizing their PCOS. Metformin is frequently added to all fertility treatments for PCOS women, and it can help in reducing chances of high blood sugar also if women with PCOS have the same problem. Then we have the problem of excessive hair growth in women with PCOS. Again, hormonal pills can help these women. Certain class of hormonal pills help in reducing the amount of testosterone in the body, which can help in reducing the hair growth. Of course, there are creams that are available. Then dermatological procedures can be done, and the same goes for acne. Again, pills can help in reducing the amount of acne for some patients. Otherwise, dermatological treatments are recommended. Another modality of treatment that is done for PCOS patients is surgery. And this involves a laparoscopic ovarian drilling, in which small cuts are made inside your abdomen and cameras are introduced to see how your ovaries and your uterus look, and then small holes are drilled in the outer surface of your ovary. When these holes are drilled, the hormonal profile of the body changes, because of which women tend to ovulate quite frequently. Their hormonal imbalances are corrected, and the effect can last for quite a few months. The advantage of going for surgery is that no treatments will be needed if you are ovulating post that, and you can conceive naturally. And it reduces the risk of having multiple pregnancies, which can be a side effect of taking medication to conceive. The disadvantage of surgery is that it is a major surgical procedure, so there are the risks of the surgical procedure as well as the risk of anesthesia. All in all, there are many treatments that are available, and it completely depends on what the woman wants. A woman who is not planning on conceiving can easily be put on hormonal pills to regulate her cycles, improve her acne, improve the PCOS, and once she wishes to conceive, she can be put on drugs for ovulation induction. Additionally, metformin can be added. PCOS is very important to control because it has long-term health consequences. Women with PCOS have a high risk of developing heart disease, have a high risk of developing type 2 diabetes. Especially Indian women tend to have a higher propensity to develop PCOS. The most important treatment strategy for women with PCOS, however, is lifestyle changes. Regular exercise and a healthy diet is very necessary. A lot of women will see an improvement in their PCOS just with using lifestyle changes itself. Lifestyle changes like a healthy diet and exercise is also recommended for women who are not obese because, like I mentioned, high insulin is also seen in these women. All in all, it is not a very difficult condition to treat. It completely depends on what problems you are facing. And even though there is no permanent cure, the symptoms can be easily managed. If you have any other further queries, please write down in the comments below. I will try my best to answer them. Thank you.